Well, further afield now, doctors treating U.S. President Donald Trump say that he continues to recover well from the coronavirus and might be discharged today. Speaking outside the Walter Reed Military Hospital in Maryland, where Trump was admitted on Friday, his medical team said that he had experienced 2 temporary drops in oxygen levels. So for the latest on this story, we cross now to our foreign news editor, Sophie Mokoena. Sophie, good morning. So what is the latest regarding Trump's health?
Well, we expect President Trump, as per the information from the physician, that he will be discharged today. But questions are being asked in terms of his condition, whether what we are getting from the medical team is correct, because every time after the announcement, there are more leaking information in terms of his condition that contradicts whatever the doctors are saying. And we know that yesterday, to indicate that it is not as rosy as it is being portrayed in terms of his condition. Yesterday, we're told that he had to be given oxygen, but secondly, he has been given a very, very strong, powerful drug, the steroid drug that is trying to assist him. And yesterday, after that press briefing, he tried to portray a brave face, but also to demonstrate that he is doing well. Let's take a listen at what President Donald Trump had to say yesterday.
We're getting great reports from the doctors. This is an incredible hospital, Walter Reed. The work they do is just absolutely amazing, and I want to thank them all. The nurses, the doctors, everybody here. I've also gotten to meet some of the soldiers and the first responders, and what a group. I also think we're going to pay a little surprise to some of the great patriots that we have out on the street, and they've been out there for a long time, and they've got Trump flags, and they love our country. So I'm not telling anybody but you, but I'm about to make a little surprise visit. So perhaps I'll get there before you get to see me. But I just, when I look at the enthusiasm, and we have enthusiasm like probably nobody's ever had. Our people that love the job we're doing, we have more enthusiasm than maybe anybody. So it's been a very interesting journey. I learned a lot about COVID. I learned it by really going to school. This is the real school. This isn't the let's read the book school. And I get it, and I understand it, and it's a very interesting thing, and I'm going to be letting you know about it. In the meantime, we love the USA, and we love what's happening. Thank you.
So, Sophie, about this drug that you were talking about, is there more information available about it? And also, is Donald Trump likely to be discharged from hospital today?
Well, we don't know. It will depend today. Maybe the condition will allow him to be discharged. But I think the main question many people are asking, it is the drug that he's taking. And you can't take that drug if you are not seriously ill. Let's take a listen at what the WHO director had to say about this drug, Dr. Michael Ryan.
It's exceptionally important that this drug is used under medical supervision. This is not for mild cases. This is not for prophylaxis. This is a very, very powerful anti-inflammatory drug. It can rescue patients who are in very serious condition where their lungs and their cardiovascular system around their lungs may be very inflamed. So this allows possibly that patients are able to continue getting oxygen into their blood from their lungs for a very critical period by rapidly reducing inflammation at a critical period in their illness. It is not a treatment for the virus itself. It is not a prevention for the virus. In fact, steroids, particularly powerful steroids, can be associated with viral replication. In other words, they can actually facilitate the division and replication of viruses in human bodies. So it's exceptionally important in this case that this drug is reserved for use in severely ill and critical patients who can benefit from this drug clearly.
And that's the latest regarding Donald Trump there with SABC's News' foreign editor, Sophie Mokoena. Well, moving